Hey everyone, this is our third installment of helpful hospice information from Bluebonnet Hospice. We're so glad that you joined us today. Of course, Mark is back with me today, and then we also brought in Angela Crow Jones, who's one of our social workers. And today we're going to talk about our supportive care program. And so I want Mark to tell us, how did this program begin?
Supportive care for Bluebonnet began from our staff members, specifically social workers, seeing the need that there were people that we could serve in our community that may be between, needing home health care or needing hospice, or maybe working through the process of mentally accepting and understanding where they were with their health. Our program began in about 2011, so it's been around for several years, and it's been a very foundational program for us to serve the community through. And the inner workings of the program are known most well by Angela, and that's the part that I always like to let her give her good instinct on. So
yes, Angela, tell us a little bit about the program and how people can find out more about it.
Okay, so supportive care was designed for patients who have increasing healthcare needs. Maybe they're having a decline in their health and needing more support with health, maybe needing more support with local resources, but they're not connected to an agency to help with that need. It might be a patient who's currently on home health care, who is just trending toward a little bit more of a support for them. It might be a patient who is appropriate for hospice care, who physically meets hospice criteria, but emotionally, maybe they're just not quite ready to make that decision just yet, but they do need resource support. They do need help along the way, and they maybe need help deciding when is the appropriate time for them for hospice. It might be a patient who's emotionally ready for hospice, but physically they just don't quite meet criteria yet. So we're looking at patients that all have needs, whether they're emotional needs or emotional and resource needs or things of that nature. So my part is to step in and help them in that in-between time, to help by looking at community resources, whether that be caregiver assistance, whether that be equipment, drug programs to help with their medications, all of those things. And then along the way, helping them and their family with the emotional support piece of that, with identifying changes. Sometimes it's easier for those on the outside to identify changes than someone who's with the patient every day. So talking them through identifying changes that may lead them to another level of care. It might be connecting them with home health care. It might be connecting them with hospice care. It might be helping them find a long-term care facility or assisted living facility, or a higher level of care than what they're currently getting to help them better meet their needs. Frequently, we'll have patients who reach out to us or were referred to us by their physician for hospice care. And once we do the evaluation, they aren't quite appropriate, or there may be a treatment that they still want to try. Maybe they're still doing chemotherapy, or maybe they want to try another physical or occupational therapy or something that might still make a difference for them. And so I continue to follow them with supportive care so that they have a connection along the way, and they still have someone to reach out to along the way while they're trying that. And if that's successful, then at some point they may not need supportive care anymore. If they decide those treatments don't work, then that's when they would transition to either home health care or hospice care, or whatever level of care is most appropriate for them.
What I like the most about what you said is that you're there to help guide them through that. Sometimes it's hard when you're so close to a loved one that you may not see decline, or you may not see the needs that are there because you see them every day, every hour. And so it's important to have someone kind of help you walk through that process. So it's great. And you've done this for quite a while. How long have you been with Bluebonnet in this role?
I've been with Bluebonnet altogether for 14 years. And I took over the supportive care role in 2016. So I still see hospice patients as well, and then manage the supportive care patients. So that, keeps me involved on both sides of it.
That's great. So you have a lot of knowledge within this role, which is really great. So tell everyone how they can find out more information, how they can get plugged into this program.
So this program we provide as a community service program. To be able to meet the needs of more patients. So it's not something that there are strict criteria. If you're needing the resource help, if you're needing the help with someone guiding you through to determine an appropriate level of care for you, maybe you're not sure exactly what it is you need, but you're having some decline in your health. You know that there are probably resources out there that you need. You can call our office at 254-751-1790. Or we have an email address that's specific to supportive care, and it's just supportivecare@bluebonneths.com. And if you send an email through there, that email will come to me and I can respond directly to you. It may be that you don't know if this is something that's appropriate for you, but if you have a need and something that you would like to discuss and see if there is help available for you, then please reach out. I'd be happy to help you.
Yeah, that's great. So reach out to us. Let us know how we can help out. Hospice or supportive care, we're here to help you through it. And remember that you have a choice when choosing a provider, and Blue Bonnet wants to be able to help you through this. So we'll be back next week. Thanks so much for joining us. Bye.